Hi, good morning. I'm checking to see if Chairman Williamson has joined yet. Chairman Anthony Williamson. Yeah, we'll give him another minute. He may have technical difficulties. I know the weather is pretty bad in some areas, so that may be impacting his ability to jump on this morning. I will wait just another minute and then we'll get started. And I guess Dr. Rucker, in the event that Chairman Williamson is not able to join this morning, would you be willing to stand in? Or
I'm
would
okay.
another member of the committee be willing to stand in?
I'm okay. I don't know about reporting on the next meeting. So, but I'm okay with just, listening, but I know that there's a report that's required for the next one. So I don't think I'm prepared for that this morning.
Okay.
Thank you.
All right, we'll go ahead and get started. Good morning, everyone. My name is Lynette Rhodes. I am the Executive Director for the Medical Assistance Plans Division with the Department of Community Health. Thank you for joining this morning. My apologies for our delayed start this morning. It looks like our chairman, Anthony Williamson, may be experiencing some technical difficulties this morning. And has not been able to join the call just yet. So, but to be respectful of everyone's time, we'll go ahead and kick off. And if he is able to jump on, we'll bring him up to speed and to catch him up. In the meantime, Dr. Cynthia Rucker, who is also a committee member for the Care Management Committee, will kick us off and just call the meeting to order this morning.
Good morning to all, and we do call the meeting to order, and we do recognize, especially in North Georgia, there are some outages. So our committee chair is probably experiencing some of that.
Okay. All right, and it looks like we have all committee members present this morning. Thanks everybody for joining, with the exception of chairman. So that's been noted and will be recorded in the meeting minutes. And I do know that we distributed to the committee the meeting minutes from the May 11th committee meeting. Wanted to check to see, did anyone have any questions or concerns, or if not, can we get a motion to approve those?
Motion to approve, Dr. Coles.
Okay. Second?
Roger Folsom.
Awesome. All right, so thanks everyone. We're going to dive into our agenda, but just wanted to share with everyone what we're going to cover this morning. We're going to, of course, give an update on the Medicaid and Peach Care for Kids redeterminations. As you guys are aware, this has been a major area of focus, not only in Georgia, but nationwide. And so we've reported out on this over the past couple of meetings to the committee. So wanted to give an update to everyone this morning. Then we'll spend a little bit of time talking about the pathways to coverage 1115 waiver, which went live on July the 1st. So I'm very excited to report on that this morning. And then provider revalidation is another major area of focus that we want to cover with the committee this morning. And then, of course, open it up for new business and any closing comments. And then we will, of course, adjourn the meeting. So that is going to be our agenda for this morning. If you'll give me just a moment, I will share the presentation. Pull that up for the committee. All right, and want to confirm, can the committee see the screen? And see the
Yeah.
presentation?
Yes.
Yes.
Okay, awesome. All right, so we'll dive right in this morning. So as you will recall from our May 11th meeting, we did talk about the redeterminations. We shared with the committee, let me close out this section here. We shared with the committee the fact that redeterminations in Georgia began in April of 2023, along with many other states across the nation. And so just wanted to remind everyone again that members will go through this process over the next 12 to 14 months. So remember, this full process is a 14-month process. Not all members will go through this process at the same time. Remember that each and every member has been assigned a specific month for their redetermination. We have aligned the redeterminations with our SNAP and TANF programs to streamline so that members don't have to go through this process multiple times. And we've talked about that before, but just wanted to remind the committee of that fact. And again, remember that we must be complete with all redeterminations by May of 2024. And again, this is a mandate from CMS. So wanted to just remind folks again about the ways in which a member can complete their renewal. And we try to promote and remind the general public about this at every opportunity. We do know that there are, members who are learning about this each day as this process goes on, as well as providers and various stakeholders. So it's not our intent to be repetitive, but just to make sure that we continue to communicate, over communicate to the extent possible about the process and what members will need to do in order to complete their renewals. So again, remember, there are 4 ways in which a member can complete their renewal process. That can be done online by logging onto the Gateway website. A member can also call in to the 1-800 number and speak with a representative who will assist in completing the redetermination. They can go in person to a DFACS office. The DFACS offices are open. We do have specific office hours for each of the locations. And we have a link here that members can access, or our partners can access, to determine the hours in the various locations of the offices. And then finally, a member can also request a pre-populated paper form, and then those will be distributed as well. So they can call in to request that pre-populated paper form, or they can submit a request via email, or again, go to a local DFACS office. So I shared with you during the May meeting that some of the members may be renewed through the auto renewal process. And if you will recall, I described it more in the terms of 2 buckets. So bucket A being those individuals who are auto renewed. And remember, if you go through the auto renewal process, that member does not have to take any action. The state will utilize its external sources to try to glean and obtain as much information as possible about the members, and then complete that process on our own without having to request documentation or information from the member. So that's bucket A, which is the auto renewal process. It's also referred to as ex parte. So we use those terms and phrases interchangeably, but in essence, it's the auto renewal process. And then bucket B consists of those individuals who we are unable to auto renew. And remember, as I shared in May, those individuals will receive a notification in the mail or email informing them of how to go in to complete that process. And so again, you're either falling under the auto renewal process or you're going to get a renewal form. If you look at the 3rd bullet here, this is something that I definitely want to re-emphasize. For individuals who are terminated, due to non-responsiveness. As a reminder, those individuals have a window of 90 days in which to submit the requested information. So if someone is terminated because they did not respond or they didn't receive the notice, that individual has a 90-day reconsideration period in which to submit the requested information. Once that information is received, it will be reviewed by the Department of Family and Children Services. If it's determined that that individual is eligible, as I shared previously, that person will be deemed eligible retroactive back to the date of termination, so there will be no gap in coverage. And again, finally, members who disagree with any termination can always file an appeal and request that those benefits be continued. Since we last spoke with the committee in May, we've made some updates to our GAMMIS website and portal, and we're also working on some additional flexibilities. So the Georgia Medicaid Management Information System is the system that our providers utilize to go in and to submit all of their claims data, and also to obtain information regarding the members. And so one of the things that we've done since we last spoke in May is we've programmed the system so that providers can now go in and update a member's contact information in the MMIS system. So that's a new capability that exists at this point in time. Prior to us making this change, a member would have to call in to update that contact information, but that ability now is available for providers. And we did that because we know that members are going to present at your facilities, right? At your hospitals or at your offices or your practices or your clinics. And so we wanted to give providers the ability to update that member's information. And that at the end of the day helps everyone, right? So now we have updated contact information, and now we can make sure that we're sending the notices to the current address of that information, of that member. Providers can also now see the redetermination dates in the MMIS system. So that's the second bullet here. That is also a new capability that exists in the MMIS system that did not exist previously. So if you are a provider, you can now log into the MMIS system and you will be able to see your patient's redetermination date. So again, that's going to be very helpful. We received that request from a number of facilities, hospitals in particular, I know really wanted to be able to see that data when they logged in. So that capability exists today. And then finally, since we've last met, CMS, the Centers for Medicare and Medicaid Services, has issued out some additional flexibilities that states can take advantage of. And again, this is to help to reduce the number of terminations and to increase the number of folks that are approved and continue to receive services. So we are working with our sister agency, the Department of Human Services and the Division of Family and Children Services, to try to implement some of those additional flexibilities as appropriate. One of the ones that we're definitely working on at this time involves our care management organizations. So per CMS, we can now allow our care management organizations to log into the system and to assist a member with completing their redetermination. Previously, that was prohibited and not allowed. So as the committee is aware, the majority of our members, our Medicaid and CHIP members, are enrolled with the managed care entities. So now those CMOs will be able to go in to the gateway system, populate the required fields, assist that member, and then that member will be able to submit their request for renewal or redetermination. So we're working through that process and hope to have that stood up in the very near future. In terms of member outreach activities, again, just want to share with the committee all of the things that we're doing on our end. I mentioned to you previously that the Department of Human Services was able to obtain a contract with a PR firm. That firm is Jackson Spalding. So we've been working with them probably for close to a year now, I'm thinking, on preparing for redetermination and also doing a lot of the outreach. So I've listed for you here all of the things that we're doing through that contract with Jackson Spalding. So a lot of digital marketing, paid media, press releases that we've sent out. We have partners and messengers that we're working with, and also our care management organizations. Additionally, we are reaching out to our members through the following modalities. Text messaging is a very good way to reach out to our members. That seems to be the most effective in terms of getting their attention. Of course, regular mail, phone calls, robocalls, social media. We're very active on social media, Facebook and Twitter. We have billboards posted across the state. Various flyers and posters are posted in several locations. Of course, the radio and media updates. We've also shared with you guys previously information on the state covered website. And so we've made updates there as appropriate. And so the member toolkits are available, the list of frequently asked questions. And then we, of course, have our partnership with CMS. And I shared with the committee previously that we were one of, I think now 10 states, one of 10 states selected to do a pilot with CMS. And what the pilot is they have sent to the 10 states a certain number of individuals. In Georgia, we have three individuals who are actually going out to community-based organizations and providing information on redeterminations. So their reach expands beyond just the typical providers. And so they're going out to, for example, food banks, our local Walmarts and retail stores. They're going to pharmacies and leaving, flyers and pamphlets at the front desk at the various pharmacies. They're going to our local churches. They have definitely been plugged in and very active with the back to school events. And so they're present there handing out information about redeterminations. So I wanted to make sure that the committee is well aware that there are several efforts underway to try to get the word out and inform members about this process. So we're going to those places where we know our members are and sharing this particular information. So want to talk a little bit about the numbers and what we're seeing. And so again, remember each member, as I've stated previously, is assigned a month in which they will go through the redetermination process. And so we previously talked about May and June data. And I also want to share with the committee and those that are listening, we are posting on the DCH website the statistics on a monthly basis. So on the 8th of each month, we are required, along with all states, to submit to CMS a monthly unwinding report. And in this report that's due on the 8th of the month, we identify the number of members that are scheduled for a renewal in each month, right? So we just submitted the report for the month of July. And so it identifies the number of persons that have to go through the renewal for that month. It identifies the number of persons who were able to be auto-renewed, the number of persons who were terminated, the number of individuals who we submitted pre-populated forms to. So it's a pretty detailed report that we are required to submit on the 8th of the month. And again, this is across the board, nationwide, all states. And so we're submitting those reports as required, and we are posting them on the DCH website for public consumption. So anyone in the public who wants to see where things stand will be able to actually go to our website and see that report. So we just submitted the July report that is going to be posted on the DCH website if anyone wants to take a look at it. But for July, wanted to talk about what the statistics look like. So there were a total of 200,943 individuals that were scheduled to complete their renewals in the month of July. Of those, thus far, 64,964 have been renewed. In terms of auto renewals, 45,800 of those individuals were renewed. And again, I'm on the third row here. And then 153,000 were distributed renewal forms. And thus far, 68,000 have been terminated. I do want to make sure that everyone understands that these numbers are fluid. They're fluid. These numbers adjust and change every single day. For each application that DFACS processes, these numbers will adjust. So I do not want the committee or anyone that's listening from the public to think, or be misled to think that these are the final numbers. These are not. These numbers will adjust tomorrow. They'll be different because DFACS would have processed more applications. So in terms of the numbers of folks who are going to be terminated, that will adjust. In terms of the numbers of individuals who are ultimately going to be approved, that number will continue to adjust as we process more of the application. So this is not the complete picture. This is just where we stand as of today. The information contained here for May and June is what has been shared publicly thus far. I will also share with the committee that as CMS is receiving and reviewing the data from all of the states, CMS is also posting the data publicly. So you're going to get it from the federal government. You'll see the data from CMS, and you will see the data from the state of Georgia. So I'm going to pause there to see if the committee has any questions about the data and the information that's been shared thus far.
Lynette, this is Roger Folsom. A question. None of the data, I don't suppose there's any way for the data to reflect. Maybe some people have opted not to renew on their own. Maybe they have chosen to moved into a position that has full insurance benefits or something differently than previously in their lives. So does the data reflect any of that information?
So it, as posted on the DCH website, so I think I'll respond to that in a couple of ways. We're issuing a press release. I think that this is an excellent question. We are issuing a press release that talks about the data. And in the press release, we are going to give some additional context. And in doing so, we will talk about exactly what you just described. So you're absolutely correct. There are going to be some individuals who do not renew their Medicaid coverage. They're not going to respond. And one of the reasons why they're not going to respond is because they have employer-sponsored insurance. And in the press release that we're going to share, we're going to talk about that. So as everyone is aware, unemployment in the state of Georgia is right now at an all-time low, right? So that's a good thing. That's a good thing. And that's because the job market right now is very good and has been very good for quite some time. So some of the individuals who applied for Medicaid during the public health emergency have obtained employment and are now able to utilize employer-sponsored insurance. So they no longer need Medicaid. In terms of additional context, there are also members who have moved outside of the state of Georgia. So they are no longer eligible for Georgia Medicaid. So while that's not reflected in the numbers that you see here today, it is definitely a factor that we are aware of. There are also instances where we have members who have aged out and are no longer eligible for that reason. So for example, in our CHIP program, or the Peach Care for Kids program, if you are over age 19, you are no longer eligible for CHIP. So those individuals will be terminated. So to your point, yes, there are definitely reasons, valid reasons, not just non-responsiveness or procedural terminations, but there actually are valid reasons why an individual may no longer be eligible for Medicaid or Peach Care for Kids, or why that person may not respond. So I hope that gives some additional context, but that information is definitely going to be highlighted in the press release that we're going to send out. And CMS has also honed in on those factors as well. And so in the data that CMS is sharing, they're providing that additional context as well.
Thank you, Lynette.
Any other questions from the committee?
Ms. Rose, I was just going to make one comment. I think it was really good that you shared about the numbers being fluid and reminding
Yes.
us that they're fluid and that they change, because I think sometimes we look at them and think this is it, So
Right.
I appreciate that, because that gives a different perspective.
That's correct. Thank you. And yeah, DFACs, they're working. They are working. And so they are processing applications, daily. And one thing to keep in mind, they're processing renewals on a daily basis. They also have incoming applications that they're processing on a daily basis. So it's just a lot of movement that's occurring here. So just wanted to make sure that folks were aware of that. And again, here, I've just shared for you our requirement to report out to CMS on the 8th of each month. Again, those reports are publicly available on the DCH website, and that CMS is going to follow up with issuing some reports as well. So I want to shift and talk a little bit about pathways. So since we've met in May, I am so excited to announce that we have gone live with our Pathways to Coverage 1115 waiver. And so we went live on July the 1st. And as a reminder, the Pathways waiver is designed for individuals ages 19 through 64 with incomes of up to 100% FPL. One of the main differences is that in order to qualify for Pathways, you have to meet the qualifying activities, and I'll talk about those in just a moment. And individuals who are interested in Pathways must opt in. And remember, for the committee, there is an intersection between Pathways and the end of the continuous enrollment requirements. And if you will recall at our last meeting, I shared with you that I tried to identify those individuals who we thought would be eligible for Pathways, and we delayed their redetermination date to allow us to go live with Pathways, to stand it up. And then we're contacting those individuals, informing them of the option for them to apply for Pathways. And we did that to prevent a gap in coverage and service. So if those individuals are able to transition onto Pathways, they'll continue to receive Medicaid coverage, which is going to be good for them, good for the state. And so there'll be no gaps there. As of yesterday, I will share with the committee that we have 265 individuals who have been approved for Pathways. We're processing those applications too as they come in the door. So 265 individuals are now eligible and will begin receiving services, Medicaid coverage, through our care management organizations. We continue to work with CMS on our monitoring and oversight metrics. So that work is still underway with CMS. We're meeting with them in some instances on a weekly basis and in others bi-weekly, but just wanted the committee to know that there's still some more work that we have to do for Pathways. But overall, the core functionality is stood up. and the program is working. So remember, for the pathways qualifying activities, the individual must complete at least 80 hours per month of the various qualifying activities. So they have to be able to demonstrate that they're doing that each month. And the individual must meet those qualifying activities at the point of application. So if someone is applying for pathways today, on August the 10th, they have to demonstrate that they met the 80-hour requirement in the month of July, in the previous month. And then they will have to demonstrate that they're meeting those requirements ongoing. And so we've listed for you here examples of the qualifying activities. So of course, if you're working, employment, whether you're employed with someone or self-employment, on-the-job training, higher education, community service. So these are examples of the qualifying activities. We're continuing to monitor and review all of the applications that we're receiving today. And so we'll continue to keep the committee posted on the progress of pathways and how that's moving forward. Wanted to, again, just remind you all about the communications plan, really for all unwinding activities and including pathways in that. So again, the statecovered.gov website. We continue to collaborate with provider and member associations. So I really do want to thank the various provider associations that have reached out to us and asked us to do webinars. We've done several of those now. We'll continue to do those going forward. Of course, the banner messages and then the work with care management organizations. All right, and again, how can providers help? We've talked about this, and this is informing your members about redeterminations, updating their contact information to the extent possible, assisting. So I want to shift focus now and talk about provider revalidation, because this is also a very important topic that is going to impact providers. So federal regulations do require that all enrolled Medicaid and Peach Care for Kids providers revalidate their enrollment at least every 5 years. This is not a new requirement. This has actually been in place since March of 2011. This was part of the Affordable Care Act, and so it's continued on. So again, every 5 years, providers have to revalidate their enrollment, and states, the Medicaid agencies, have to demonstrate that this requirement is being met. And so what is revalidation, right? We've talked about this at a high level, but haven't really dug into what it means. It just basically means that the providers have to confirm the accuracy of their enrollment information. So they have to log into the GAMMIS system and confirm that their name is correct, date of birth, all of the demographic information, but also that their address is correct, right? So are they still practicing at the same location? If not, they need to notify us, or if there's been a change of address, we need to be notified of that. In addition to the requirements that you see here on this third bullet, we also want to confirm ownership information. So is the owner still the same? We need to confirm information on your managing employees as well. So that's what the revalidation process is. You're going in as a provider and confirming that the information that we have is correct. So in going through our database and looking at the number of providers who need to complete this process, I want to share with the committee, there are approximately 87,000 provider locations that need to be revalidated. Again, about 87,000 provider locations that need to be revalidated. And so we have set a deadline for this of September the 15th. It is imperative that providers go in and complete this process. And so providers who do not revalidate by September 15th will be suspended on September the 16th. And so we are working with the provider associations to get the word out to all providers so that they are aware of this requirement. And I do want to give special kudos just to a couple that have already jumped on it. So the Georgia Hospital Association has the list of hospitals in the state of Georgia that need to complete their revalidation. And they have already reached out to those hospitals because we are getting emails and phone calls from the Georgia hospital saying, what do I need to do to revalidate? How do I get this completed? Also, the Georgia Dental Association, they have the list of providers and we are in active communications. And so they will be reaching out to all of the dentists, whether that's by way of, I think, a newsletter or, whatever processes that they're going to implement to try to contact and notify those dentists. They are on board and hit the ground running. The Georgia Academy of Pediatrics, the Association, I think, of Family Physicians. So they're all plugged in. And we are making calls to the other associations and sharing the data and the list with them as well. We have posted on the GAMMIS portal, on the GAMMIS website, the list of all providers and their locations that need to be revalidated. So that list is now up on the GAMMIS site. Anyone can go in and download it. You don't need a user ID or password. It's available to the public at large, but you can go in and see if your name is on that list. And if so, then you'll know that you need to complete this revalidation process. If you are suspended, what that means is that any claims with dates of service on or after September the 15th will not be paid because that provider is in a suspended status. So that's why we're getting the word out and encouraging providers to complete this process. And even if a provider completes the process, once they reinstate, their new effective date will be the date that their revalidation application was submitted. And so providers who fail to complete the revalidation process within 30 days of suspension will be terminated. So this is major. Again, this applies to all providers across the board. If you're a DME provider, durable medical equipment, you have to revalidate. If you are a dentist, if you are a hospital, if you are a physician, if you are a nurse practitioner, if you are a facility, you have to complete this process. And again, September 15th is the deadline in which to get this done. So these are the ways in which we're going to communicate this out to the providers. Banner messages are going to be posted, frequently asked questions. We're going to put this out on the DCH website. We're sending written notices to all of the providers impacted by this. Again, I just mentioned that the list is on the GAMMIS site. We will engage all provider associations. So if you are a provider association and you are listening today, and I know some of them are on, we desperately need your help. We do not want to suspend providers, but this is a federal requirement. This is not a DCH requirement. This is clearly stated in federal law. And so we have to comply with these provisions. And then our care management organizations are going to assist with this effort as well. So I'm going to pause there to see if there are any questions from the committee as it relates to provider revalidation. Okay, hearing none, we will shift. That concludes today's presentation. And so hearing no questions at this point, we will shift back to our agenda. Let me pull that back up and we will see if we have any new business to cover today. So give me just a moment to pull back up our agenda. All right, just confirming that everyone can see the agenda. Can
We
you
can
guys see
see-
this? Can you all hear
Yes.
me?
Yes, we can see the
Okay,
agenda.
awesome.
Thank you.
All right, so I will open it up for any new business. And I do have, I guess, just a couple of comments here, but I'll open it up for new business. Okay.
This Dr. Coles, I don't have new business, but I do have one question. Are you having,
Yes.
are you having any trouble obtaining an adequate number of providers?
So I think you're speaking just generally in terms of network adequacy. Is that the
That's
overall
correct.
question? Yeah, so there are areas within the state of Georgia where there is a shortage of providers. And that's been, the case and the realities, I think, for many, many years now. Are we able to overall meet network adequacy? The answer is yes. The answer is yes. There are a sufficient number of providers available to serve our members. However, in those rural areas of the state, there are or has been a shortage of providers over the years. And the way that we try to address those shortage areas is through utilization of telehealth, as an example. So during the public health emergency, we significantly expanded the use of telehealth and the capabilities and what services could be rendered and how they could be rendered. So we try to address those shortages through telehealth. Non-emergency transportation, right, is another way that we try to address that. So if you're a member in a county where there's a shortage of a particular, provider type, and you need transportation to be able to get you to a provider, then we will transport you and provide transportation for you to get to the next county where there is a provider. And then I think the last thing that I'll mention is that our care management organizations do quite a bit to try to recruit and bring providers in the state of Georgia. Over the years, and I'll, of course, never want to just, call out one health plan over the other, but, for example, this is just an example, Peach State actually did donate and contribute, a significant amount of money to one of our local hospitals to assist with a medical program that they had for students who were enrolling in medical school. And so they would, for example, waive their student loans, right? That's incentive to waive student loans or to cover their student loan payments. If they would complete the program and commit to staying, within the state of Georgia for a certain number of years. And the other CMOs do similar types of, have similar types of programs where they actually, try to incentivize practitioners to come to those rural areas of the state, to provide services. So I hope that gives some context there. But the overall question is, yes, we do have sufficient providers, but there are, without a doubt, areas of the state of Georgia, particularly the rural areas, in some areas where there is a shortage of providers. We try to address that through telehealth, non-emergency transportation, and other modalities as possible.
Oh, well, thanks. I don't want to belabor the point, but
Yeah.
I am a rural physician. I
Yes.
live in a county of 17,000 people. And there have been 3 papers that have been published within the last 2 months regarding physician manpower in the United States. And it is predicted in all 3 of those papers that within the next 18 months, that is by January 1st of 25, 65% of the physician workforce will have quit or retired. That is a significant number. And if that occurs, one of my concerns is that we're just simply not going to have the manpower in terms of physicians to adequately meet the needs of Georgians. And this is a nationwide problem, not just a Georgia problem, but we don't want to get to that point and then say, my goodness, what are we going to do?
Yeah. I agree with you. So, and perhaps what we can do is let's add this as a agenda item for our next quarterly meeting. So I've made note of that. And what we will do is we'll take that back internally at DCH and discuss some potential options or, what we can look at to try to begin addressing this issue going forward. But I want to thank you for bringing that up as a new business item, and we'll work to monitor that and see what we can come up with, some solutions.
And if you want to get in
forward.
touch with me, you can. And because I have some ideas about solutions.
Got it. Thank you for that.
You're welcome.
Any other items that the committee wants to address? Okay, so over the past couple of committee meetings, we have focused on the redeterminations and where things stand and how things were progressing. And while that absolutely is a very important topic to discuss, we don't want to make that the only topic that we're covering during these committee meetings. And so I would like to know if there are any other specific topics that the committee wants to cover. You guys don't have to answer that right now. You can follow up with me via email. But one of the things that I thought would be pertinent that we, that's been on the agenda nationwide is how we are addressing health disparities. And so we're going to, at our next committee meeting, present out on some of the solutions that our care management entities have put in place to try to address health disparities. Dr. Holloway will lead that discussion. And so I thought that would be interesting. It's a major area of concern nationwide. And so we do need to talk about that and how we're addressing it and hear from the committee in terms of any recommendations, or solutions that you may have. And I think there's also a request out to also hear about some of the processes that the CMOs are utilizing and some data on prior authorizations and how that is panning out across the care management organizations. And so we can talk about that as well. But if you have any other specific topics that you'd like for us to address, please send those to me and we'll get those on the agenda. I just don't want to lose sight of the overall purpose of this committee, right? And so while redeterminations are critical, we just want to make sure that we're not making that the only area of focus. So I'll pause there to see if there are any comments in response to that.
Ms. Rose, I do want to thank you for opening that up because there are so many different issues, and it's great to be able to utilize this committee and the meeting time to actually discuss, just like Dr. Powell's just talked about. So I think that's great.
Okay, so I will look to receive those updates or requests from the committee. And then we'll be prepared to present out on those items during our next meeting. Otherwise, Dr. Rucker, I'm going to turn it over to you to close us out if there are no other comments or concerns from the committee. Thank
you. We definitely thank you for this great detailed report. It's It's very detailed. So it did answer some questions for me, and I know it probably answered some for others. So we are going to adjourn unless anyone has anything else to share.
All right, thank you. And Dr. Rucker, I will give the report to Commissioner Russell for the next or the upcoming meeting.
All right. Thank you.
All right,
Thank you.
thanks,
We'll adjourn.
everyone.
Thank you.
We appreciate it.
Thank you.
Okay. Bye-bye.
Bye-bye.